My name, for anybody who have not met me, is Lisa Dempster, and I am the Minister for the Department of Children, Seniors and Social Development. As the Minister responsible for seniors, I am very proud of the work that our government has been able to undertake to support seniors in our province. One initiative that I'd like to highlight here is the establishment of the Office of the Seniors Advocate, only the third of its kind in Canada. Premier Ball saw the need for this independent voice for seniors and committed to make it happen, and we delivered on that commitment. And it's nice to see Dr. Brake here this morning. Thank you for taking time from your busy schedule to join us. When we launched The Way Forward, our vision for sustainability and growth in Newfoundland and Labrador, we also committed to deliver better services, better outcomes for residents, including seniors. Today, we are pleased to have the Honourable Dwight Ball, Premier of Newfoundland and Labrador, with us to make an important announcement to do just that. I'd like to ask Premier to come forward.
Well, good morning, everyone, and thank you, Lisa, for the introduction this morning. International Day of Older Persons and National Seniors Day. Just imagine. 19% of our population today is over the age of 65, and within 10 years that will rise to 27% of our population. But the question I ask is, why is 67% of us sitting in those chairs part of the older group? Sorry, John. So it's you and I. Knowing this, we need to identify what would be the best approach as we secure better outcomes and provide better access to services that matter most to people. Every one of us can share an experience of people that we've known in our lives that have had struggles and issues around assessment tools in our province. As a government, we've enhanced our focus to ensure that our older persons and older population, that they remain healthy, active, and engaged citizens living in their own homes and their communities as long as possible. One of the things that I often refer to when people talk about aging and an older population, some people look at that as a negative, and I continue to say that when we look in our communities, some of the most vibrant communities that we have are there because of the contributions that some of the so-called older persons continue today to lead in our communities. For an example of the number of initiatives that we have created is, as Lisa mentioned, the creation of the Office of the Seniors Advocate, a continued investment into age-friendly Newfoundland and Labrador communities, an introduction of the Newfoundland and Labrador Income Supplement, and the expansion of the seniors benefit in order to support low-income seniors and those individuals and families with persons with disabilities. As a government, we have been working very hard to ensure our spending in health care remains sustainable. Since coming into office, our administration has kept the budget to health care relatively steady at $3 billion, which is a significant part of the investment that we make into our communities. But part of our work means changes that will lead to improvements into overall budgeting for health, striving to get the best value for every dollar that we spend. Our job is to make sure we spend your taxpayers' money wisely. So as we continue to work forward, we recognize the value of listening to people that are heavily engaged in this sector. So listening to the very individuals who require these programs and the services that we are talking about, we do this on a daily basis. And we'll continue to work with them to find relevant and beneficial solutions for a rapidly aging population. That is why today we are announcing a new improved financial assessment process for long-term care and community supports. Now, we have heard it time and time again from clients and community advocates that this process should change. In response to these calls for change, we are delivering on a commitment that we made in the way forward to make the application and the eligibility for the process more person-centered, client-friendly, and transparent. So starting on November the 1st, we are simplifying the process by eliminating the liquid asset testing. The term liquid asset means cash in the bank, could mean investments that could easily be converted to cash. For example, a person's savings account could even be an RRSP, could even be their home. Previously, only people with liquid assets below a certain level would be eligible for financial assistance. Beginning in November, this will change. New clients and clients already in the system will no longer have to provide proof for their liquid assets. This means, for example, they no longer have to provide bank statements or investment documents when they require financial assistance. Another change we're making is that as of February the 1st in 2019, we are dropping the needs test for specific programs and expanding income testing for all services that are offered by the Department of Health and Community Services. Previously, both income and household living expenses were part of the needs test and were being used to provide clients access to many of the long-term care supports and community support services that were available to them. As of February the 1st, that will change. Instead, eligibility will be determined through one single test, and that is the income test. The income test is an easily understood tool that can calculate a person's contribution based on their income. It makes sense. Going forward and to qualify for financial support, the health authority will only need to look at your net income. That information is available from the Canadian Revenue Agency under Notice of Assessment. Income testing is widely used in other Canadian jurisdictions when it comes to providing financial assistance for similar services. No one else uses the needs test. So starting in February, new clients will be assessed with the income test. Existing clients will also be assessed with the income test once their annual reassessment date rolls around. We believe that people will see a marked improvement when they apply for community support services. It will be consistent with all health authorities, less intrusive with people, and require a reduced amount of documentation. Basically, it's just an easier, simpler process. To make such a change requires consultation and partnership. Groups such as the 50+ Federation, Seniors NL with Disabilities, and persons with disabilities have advocated for this change for quite some time. We have heard them, and we have developed a process that we hope will address all their concerns. The health authorities have also been part of this, and over the coming months, we will work with them to ensure that the transition is seamless for those who use the system. We are proud of the strong relationships that we have built. We remain committed to working together with everyone to a common goal in supporting our province's seniors and their families. Through the way forward, we're moving ahead on the right path to provide better services, better access, and better outcomes for Newfoundlanders and Labradorians. Today's announcement is a major step, and it's in the right direction. So, ladies and gentlemen, thank you very much.
Thank you, Premier. I said we ordered sunshine, and what a great way to start today, and with a positive, good news story, an example of how we have been listening to this valuable group in our province. I'd now like to ask my colleague and friend, the Honourable Minister John Haggie, to come forward with some remarks. Thank you.
Thanks very much, Lisa. Thanks, everyone. It's really great to be here today for such an important announcement. Under the Premier's leadership, we've been focusing our efforts on better management in a number of areas, providing care in the home and community where possible, and only in hospitals when absolutely necessary, building and fortifying primary health care in our communities, and redesigning the delivery of services both in the community and in the institutional setting. The Premier's already referenced several initiatives designed specifically to help seniors, but I want to highlight some of the other investments we've also made. We've invested in new and improved healthcare infrastructure to ensure we continue to meet our aging population's needs. So we have new long-term care beds going up in Grand Falls, Windsor, in Gander, we've expanded a protective care unit in Botwood by another 20 beds. There's an opening of a further 28 beds in long-term care in Carbonear. We have a new ambulatory care space being redeveloped in Carbonear. We have a new state-of-the-art mental health and addictions facility in St. John's on the Health Sciences campus. We have new long-term care beds, 145 on the West Coast in Corner Brook, and 164 acute beds also to replace the aging Western Memorial. Through a bilateral agreement with the Government of Canada, we're going to invest $43.25 million over the next 5 years in home and community care. This year alone, we have $8.64 million for palliative care, dementia, and complex care needs. Through our Home First initiative, we've taken a person-centered approach to those who wish to remain and receive care in the comfort of their own homes. This is a message we heard loud and clear. Each health authority has established a Home First integrated network comprised of a team of health professionals. Example would be a nurse, a social worker, OT, or a PT, who are in the client's home providing on-the-ground support to keep them active and keep them there as long as is practical. After a successful pilot scheme, we've made enhanced care in personal care homes a permanent option across the province. This option allows the needs of individuals to be met in their home community, postponing or even avoiding completely moving to a long-term care home. We've had a great uptake of this, with 43 personal care homes licensed to provide enhanced care, with more than 140 residents availing of the option as of June of this year. Our province has partnered with the Canadian Foundation for Health Improvement on an initiative to improve the quality of life for patients in residence in long-term care. All long-term care homes in this province are participating in the program. It improves dementia care through more appropriate use of antipsychotic medication. And now today we've announced plans to roll out a new, streamlined financial assessment process. And as the Premier said, this process will make it easier for people to use the system. I want to highlight that it's possible that some clients already in the system may have a higher contribution when they go through the income test. We think this is going to be a relatively small number, and to minimize the impact on these clients, they will be grandfathered into the new program and will not see an increase in their personal contribution. In addition, a financial hardship policy is under development for both new and existing clients to help protect individuals. This will allow the health authorities some flexibility to adjust or waive client contributions when clients can show a significant financial hardship would occur due to the contribution calculated with the new income test. Clients requesting financial hardship consideration will have to obviously provide some additional documentation in regard to their monthly expenses to support such a request. But rest assured that the health authorities are going to work with you through the new process, and it will be a process that will work for you, the seniors of this province. We want to help clients, not hinder them or cause them any kind of undue stress in regards to their finances at what could be a difficult time of their life. Eliminating the liquid asset test as of November and moving to a simplified expanded income test as of February the 1st is a good news announcement. It's good news for seniors, their families. It will also benefit persons with disabilities and other clients of the programs that we maintain through Health and Community Services. The message is we've listened to your concerns and we're making changes based on your feedback. I would echo the words of the Premier when it comes to the value of the partnerships he's described. And at the end of the day, we all want a service that works the best for the people who use it the most. So thank you very much.
Thank you, Minister Haggie, for sharing some of the details around that new streamlined approach and highlighting some of the other wonderful things that government have been doing on behalf of seniors and residents across our province. And as I was sitting there, I was thinking, if there's one thing that we can be faulted for, it's probably not talking enough about what we're doing. I see the finance minister over there, $270 million right now, and it's been growing in every budget since we formed government in poverty reduction initiatives, the highest ever in the history of Newfoundland and Labrador, because we want to bring people to a comfortable level of living and give them a better quality of life if possible. The next individual I'm going to call up knows all about helping to improve the quality of life for individuals, and that is Mr. Robert Rogers, who is the president of the Federation Plus. And I just had the privilege a couple of weeks ago to spend an evening with him and some members of the 134 clubs from across the province down in Marystown. And I'll tell you, these are people that's contributing significantly to the province. I tried a little game as to see some faces from there in a room of over 400 people, and I said, can I have a showing of hands of everybody here who's on at least one committee in their province? And then we had a show of hands for people who's on at least 2 committees and 3 committees, and we were up to 4 and 5, Premier, and no surprise to him. We know what people give in our communities, where they come from, and we certainly appreciate it. So, Mr. Rogers, it's a pleasure to have you here this morning. Can you please come forward? Thank you.
Good morning, everybody. I would like to thank the Premier and his government, and especially Lisa Dempster, the Minister, for announcing this new streamlined financial assessment process. This policy now gives the older person financial independence when they enter long-term care facility. In August 2008, the Gander 50 Plus Club submitted a resolution at the 33rd Annual Convention in Stephenville. And that resolution was that persons entering long-term facilities would be assessed on income only. The resolution passed at convention, and this resolution has been resubmitted to the government for the past 10 years. It's interesting to note that the members of the executive in 2008 were 12. And today, there is only one person still on that executive, and that's your truly. 5 members of that board have passed away, including the immediate past president, Don Holloway, who was just died 2 weeks ago and was buried in Marystown only a few days ago, and I had the privilege to attend his funeral. I am pleased to see that a number of our board members are present here today. I look down and I see Linda Olford. Getting you mixed up. She's the first president of the Federation. I've also Elaine Hutchings, our area director for this area, and Noreen Corrine, the area director for Labrador. So we're well represented. I don't think Shirley Leto is here. No, Shirley's not here. Shirley is coming to a meeting, I think, tomorrow, and she was a member of the board representing Labrador. I leave you with a thought. Remember, growing old is wonderful, as the alternative is not so good.
Thank you, Robert. Laughter truly is the best medicine, so no matter what the circumstance, it's important for us to be able to find humor. I have to say it again, so proud to be a part of a government that values the advocacy of groups like the 50+ Federation, as well as our older adults and their families. We are listening, we are hearing your priorities, and we are working together to ensure that our policies and services deliver on that commitment to better outcomes for Newfoundlanders and Labradorians. I believe today's announcement by our Premier clearly demonstrates that our government is listening, and we are delivering on our commitment to improve, in this particular case, the announcement today, to improve the financial assessment process for long-term care and community support services. For individuals availing of these types of services, I anticipate that these changes will be welcomed with open arms, as they will now have more control over their own personal finances. And with this new, more dignified and less invasive approach. And I think that's the goal where we all want to be with our various programs. On that note, as alluded to already this morning, today marks the International Day of Older Persons and National Seniors Day. So I'm happy to say we've got lots of events lined up today. The Premier will be heading to the Capitol Hotel and joining myself and a number of others in a little while. We're going to have the privilege of recognizing 5 seniors of distinction from around the 4 corners of the province. But right now, next on our agenda here, we will be raising the United Nations flag to recognize seniors in our province. So I would like to invite, and I hope I pronounce her name right, President of the Newfoundland and Labrador Federation of Union Retirees, Marie Saint-Aubin, to come forward and join us, and I'll ask Premier and Minister Hagey if they'll step over by the flag.